Did you see the emails?
No, my computer's in there.
Okay, I'll get those printed.
Okay, good afternoon, everyone. Today is Tuesday, July the 17th. This is the meeting of the Personnel, Public Information, Human Relations, and Housing Committee. I do detect a quorum. I do want to make one procedural announcement, if I may, which would be with regard to the order in which items are taken. There is a resolution RS 2018-1309 for which I must recuse myself due to a work conflict, and so I would like to take that item last. Our vice chair is absent, and so I was wondering if I could call on former chair Murphy to chair the meeting for that last item. If that
More
would be,
than thrilled to, actually.
That would be fine, so thank you. So I will go ahead and get started with our agenda. We have resolutions. Actually, Mr. Mendez is going to join us. I'm going to go ahead to bills, if that's okay. So we will start with bills BL 2018-1255. Sponsor is myself, Councilmember Withers. This amends the Metro Code of Laws pertaining to payroll deductions for benefits administered by the Metro Employee Benefit Board. Is there a motion?
So moved.
Okay. Could I get Human Resources to let us know what this does and doesn't do, and then we may have a couple of questions from representatives as well. So,
Sure, no problem.
please go ahead.
It's a
Director
pretty
Hall.
simple administrative change. The Metro Code compels us to collect premiums for health insurance deductions and other benefit deductions 30 days in advance, which means we're taking those benefits out well before people can actually start drawing their benefits, right?
Okay.
That is not industry, I'm not even saying talking to me. That is totally not industry best practice or standard. Most every employer is going as a pay-as-you-go, right? You pay your deductions for your insurance as you use them. So we are asking to switch to be standard best practice. It's also going to correct a couple of administrative challenges that we have. One of which is because people pay in advance, when they end their employment with us at Metro, we have to go through the administrative challenge between HR and finance of refunding premiums that they had paid in advance. So we're going to be able to eliminate that entire process. Plus, we obviously have new reporting requirements under the Affordable Care Act, ACA, that require the employer-sponsored coverage, which are the forms that you now submit with your IRS forms. That, right now, we have to manipulate a lot of data because we're collecting premiums in advance of coverage. That issue will also then be administratively resolved, and it will allow a lot of ease for both finance and HR to be able to administer those reporting requirements on those forms. So.
Will this cause anybody to get like a double charge or like a miss a month or anything like that? It's all just going to be
not double charge. Actually, the opposite.
Okay.
We're going to have to your point, true up current employees, right? So they're going to be able to skip a premium. We're planning for tax purposes to run this change, and we want to be able to have plenty of time to message it, which is why it's here so early. We want to run that change concurrent with the calendar year for tax purposes, but that perfectly also aligns with us being able to give that skipped premium with the holidays. So it is a great benefit to employees at a time that they need it. It works for tax purposes, so we actually will be truing people up by allowing them, since we already have their premiums in advance, to be able to use that during a time they need it. So.
move to approve.
All right, all in favor?
Aye.
Any opposed? All right, motion carries. I will, since the sponsor has joined us, I will go back to resolutions. Resolution 2018-1289. Sponsors are Councilmember Mendez, who's present, Haywood, and Bircher. There is a letter to approve. Is there a motion? Let me read the caption. This authorizes the Metro Development and Housing Agency to negotiate and enter into a pilot agreement and accept payments in lieu of ad valorem taxes with respect to a multifamily housing project located at 3474 Dickerson Pike, known as Preserve at Highland Ridge. Is there a motion?
I move.
You move approval? Okay. Is there any discussion among the committee or questions for MDHA who is present? Hearing no.
I guess can we get a little bit further explanation about who owns this property, what's going on, and and all of that,
would
it's
love
not
to.
going through planning?
I would love to. This is property out at, on Dickerson Road, 3474, sorry. The number's confused. Nashville Leased Housing has the property under contract. They're going to be closing that. They have received a 4% low-income housing tax credit to create new affordable housing. This will be new construction coming on into place. They're going to call the project the Preserve at Highlands. It is 261 apartments. These are going to be family housing with 2 and 3 bedrooms in there. And we're requesting a pilot in accordance with the terms that were approved by council. This pilot would start off an increase, and I misspoke last night at one of the committee meetings. It actually increases. Their pilot payments are going to increase at a 5% rate per annum after the initial occupancy on that. It's a 10-year pilot payment that would take place. So your base taxes are established with that, and then they're going to be increasing 5% per year. The leases then will burn off. The property will revert back to private ownership at that point in time.
How much money will the city be losing on the taxes?
Well, it's new construction, so it's not taxes that will be getting so-called lost. The initial payments are going to be the initial first year payment is $22,765, and we estimate that the amount of the abatement, one second, I'm sorry, is, now I've lost it. I'm sorry, I had this sitting here. I've lost my pages on the abatement. Thank you. I had the piece of paper. We estimated that the property taxes would be, that the amount of the abatement for the first year is $359,000. For the 200, it would be, the metro would be giving up. They will be receiving $22,765. So it's a fairly significant abatement. These 4% credits in new construction are very difficult to make without having the benefit of being taxed again.
I understand, but right now, if we lose $10, it's too much.
Yes.
It's got to the point where we can't pay the employees. You've seen that. We're taking money back from the departments that
Yes.
already received their
No,
money.
we understand that, and we've taken a hard look at all the analysis on it. A lot of our projects have only been seeing a 3% increment on an annualized basis. This one, we did the estimates on it, and they could actually incur a 5% increase on taxes. The current taxes on it that are being paid now are less than what you will be receiving the first year of occupancy of the pilot.
And so are these MDH homes going to stay, they stay as MDH?
They are not MDHA. They are privately owned.
So this is a private developer
private developer.
that is getting it's a private developer getting the pilot. It's not MDHA.
That's correct. MDHA is approving, Metro government is approving the pilot. To facilitate the pilot, property transfers into MDHA's name, so therefore it becomes tax exempt, and you receive a pilot in exchange. And after 10 years, the property transfers back to the individual's name and will return back to the full tax.
So they get a sweet deal for 10 years.
In order to construct affordable housing. And the rent levels on these are going to be right around probably $800 to $1,600 a month.
And so after 10 years, when they go back into the developer's name, then they'll be renting at market value?
The affordability period would last about 15 years.
But what is to guarantee us that we get 15 years? So it transfers back into their name, and then for that next 5 years, it stays affordable? How do we know that?
We know that through the low-income housing tax credit program, through THDA. The program is locked down through THDA. It's also locked in on low income through the IRS regulations these are issued by the Treasury Department. And so people are very, especially the people who buy these credits, are very particular that there is no violations of the regulations that are required. Otherwise, the credits have to get
But after 15 years, they could just be where they might be renting it out for how much right now?
It goes straight to market rate rent.
Okay.
I would like to, if I could, go ahead and recognize the sponsor of the bill, which is Councilmember Mendez, wanted to offer a few comments.
Thanks. Just a few things. Because of the budget issues that Councilman Pardue mentioned, I'm going to be a no on pretty much all new spending. This is budgeted already, and it's built into the Metro budget. So this is spending money that's already been allotted for this purpose. A couple of the things I would mention is that of all the things we've done on affordable housing this term, this is I think the most effective thing we've done, because it takes these low-income housing tax credits that by themselves would not be enough to build affordable housing, and leverages the private investment and the federal tax credits along with our abatement to make it possible. The affordability period is, as Mr. Kane mentioned, totally locked in, because it's the federal and state agencies that are involved with tax credits policing that. So we don't have a lot of burden in policing it. And then I guess the last thing it's a high volume of units on these things. And the other thing I was going to mention is that we put a lot of energy, the Affordable Housing Committee and Budget and Finance, in the first couple of these we got in the beginning of our term, to make sure that they weren't just randomly scattered around. The Planning Department looks to make sure that the location is consistent with Nashville Next. And Metro Finance used to not look at the numbers at all, but now they at least they look to make sure the numbers add up. So having the process of finance looking at it and planning looking at it for the location has, I think, made it, in cooperation with MDHA, where these have been relatively seamless to get approved. And we haven't, in any year we've been in this term, we haven't come close to maxing out the amount that we've got budgeted. So this program is using up less money than has been anticipated.
How many units did you say?
This is
200.
200.
Whenever we've approved these, they've all been about that size.
Yeah, we actually just closed today on the Rebecca Towers. I don't know, you may remember that one went through. That's almost 1,000 units through there. Last month you approved another 500 units on there. So this is really a great way to keep, in the case of the Rebecca Towers, and in this case, the new construction, which we have not been able to get. The cost of new construction is just prohibitively.
Out of?
Did you have a question?
Say out of or in it?
Just one last point, then I'll shush. Just for comparison of those units, I think if you took I don't know the exact number, if you took the total number of units the entire Barnes Fund has done ever, it's like 30, I think. Yeah, I don't know what it is, but it's not
a large.
It's not 1,000. So
How are the developers selected for this process? Is it, do they already own the property?
This is complementary to THDA's process. THDA has an open application for 4% tax credits. They have a competitive for 9% credits. The 9% credits you would not see as large of a subsidy per unit because they're getting more credit, equity credit coming in. But they go through a THDA process and are evaluated by the Tennessee Housing Development Agency for that. So there are multiple eyes on this all the way through the process. And we do an annual monitoring. MDHA does an annual monitoring on the projects as well once they come online.
Thank you, Mr. Kane. Do any other committee members or members present in the room have additional questions or commentary on this one, or are folks ready to call the question?
Call question.
All right, all in favor?
Aye.
Aye. Any opposed?
No.
So 2 opposed. All right. So that was 4 in favor, 2 against.
One other thing.
Yes.
I could tell from Mr. Braystead's face that I probably misspoke about the units from the Barnes Fund. I was talking about units that like small nonprofits have developed. And we've also put money in like the big development on 12th Avenue South, which is also a lot of units.
All right. Well, thank you. So that was motion to approve, in favor 4 against, 2 4 in favor, 2 against. So our next item is Bill 2018-1257. The sponsor is Kendall, Verter and others. Approves the lease agreement between the Metro government and the Christine P. Nall Living Trust for the building located at 337 and 339 21st Avenue North.
Give me that bill number again, I'm sorry.
2018-1257. And the sponsors present, and just in the interest of time, is there a motion to go ahead and put this one on the floor? Okay, thank you. Mr. Kendall, as the sponsor, do you have any additional information you'd like to share?
Say that, Rudy, read it again.
Questions?
Okay.
Where is our current IOD clinic?
Right here,
Here?
at this location.
Oh, I was like in this building.
No, right here at this location.
Okay, so is this just like a new a new lease or a new extension?
Yes, so just an
Okay.
extension. So some of you may or may not know, the IOD clinic concept is a newer concept for us. We only started it about 5 years ago. It's been very successful, and we are very grateful that this property owner is willing to offer us lease terms where I'm sure she could get a lot more. It's probably worth noting that we have an x-ray room in here, which is very hard to secure. There's a lot of state and federal regulations there. Metro, working with the property owner, was able to put substantial investment in this building to make it a really good IOD clinic, and our employees are really leaning into it. So this is all very good stuff, and I'm very grateful that these terms and us being able to stay here can remain.
And so I would assume, Director Hall, that one of the benefits of having an IOD clinic for our employees is that they're not having to do a lot of extra paperwork of going to their doctor, and funneling it back through the IOD instead of their insurance. And is this also going to be saving us money in the long run with, I forget who the contract is with, but with the casework managers who have to go babysit basically when our employees go to see a doctor and things like that. It's all taken care of in-house, and so we should hopefully have
All those things.
less costs for case management on IOD cases.
Less cost for medical care. I mean, there's cost savings all around. And one of the other things, neat components we have is this. ASC is our third-party administrator who coordinates this. We actually have a full-time ASC representative on site.
Good.
So if the person needs to be referred out to care, they don't have to wait. They literally walk into a room right next door inside the building, and they say, tell me what doctors, what would be a good pulmonologist, what would be a good physical therapist. These are your networks of options. We've had good care with this doctor, with that doctor, but then they have their choice of providers going on from there. But we're only paying for the cost of the 5 staff members dedicated there, which means we are already saving significantly on the IOD fund, and those costs have been,
Right.
growing over the years.
And so when
This
we
is
renew
something
those
to
contracts with
mitigate.
ACS, whenever that is, hopefully our costs there will go down too.
They're not necessarily a huge cost driver. They're just coordinating the claims. But yes, they've provided a very valuable service to us. This is the right path going forward and has been 15 years in the making to have a true comprehensive IOD program that's not embedded in our medical plans.
It's a good deal, and I assume because I want to sponsor, you just accept it anyway.
The price, the
No,
rent
it's a good
prices
deal.
definitely are good. I wanted to see, hopefully we'll be cost saving on our IOD program.
We are using this model. And I shouldn't say this probably out loud. I was a little skeptical about this model. It was right about the time I got to leave this with HR, and I was coming over to work with you all as a Metro clerk. It has been a really good, effective, cost-saving, employee satisfaction program. So the clinic launching on this has been a lot more successful than I anticipated. And I managed the program for 10 years before.
Move to approve based on recommendation of Ed Kendall.
All right. All in favor? Aye. Any opposed? All right, that motion carries 6-4-0 against. And Councilmember Murphy, it's now time
I'll take
for the
over.
remaining item, if you wouldn't mind chairing the rest of the meeting.
Sure,
And
if I
I
can
will
have your pen.
depart and let y'all have a great discussion.
How you want us to vote on it?
All right.
Councilman.
So we have resolution 2018-1309 by Councilmember Gilmore with no letter. I'm assuming that there's somebody else signed on this.
Me and him are signed.
Okay, you're not.
You're not signed on.
Signed on yesterday.
I don't have you on here, but I'm going to take your word that you were signed on.
Both of us are signed on.
So this requests the investment committee of the Metro employee. If I could have a little bit of decorum in here. This requests the investment committee of the Metro Employee Benefit Board divest funds invested with entities engaged in the operation of private prisons.
Why? What's the purpose of it?
You want to take it or should I? Okay.
See, yes. What's your question, sir?
What's the purpose of the resolution? I mean, what do these try to do that would?
The objective is to prevent Metro to use our money to invest in a privatization model of our jail system.
When you say our money, you're talking about
The pension money.
pension money.
Councilman?
All right. I want to apologize to the committee. I was referring to the process of how we do our electronic signatures at times, and the timing of things and the filing deadline and other things. That's what I was referring to, just for this gentleman over here. But the reason why we're looking at this is because we know what the private prison industry is doing to communities of color and also Hispanic communities and poor white communities here in America. And right now, we don't need to be investing our hard-earned money and our citizens into organizations and companies that do unlawful things to our citizens. And right now, supporting a for-profit system, for-profit prison system, with investment funds from us, I'm not for, and other council members aren't for either. And that's why we're just asking that we ask the Benefits Board to look at other investments besides. It's a resolution. We're just asking the Benefits Board to look into other areas of investing besides for-profit prisons. And I would love to expand on that, include waste management stations, other things that involve, things that we don't want in our district anyway. And that's all.
So I will bring up, and I'm thinking that I did speak to someone as you were referring to him. I don't know if are you part of the organization that brought this, or?
That's supporting it, yes, ma'am.
Okay. Did you call me this morning?
I did, yes, ma'am.
Okay, because I did receive a call this morning, and I from you, and I asked about last summer, this committee, the Public Safety Committee, and Council Lady Gilmore's committee was a part of it too, to hold a hearing on the scabies investigation, because as Director Hall remembers, now that no, you weren't there yet. Anyway, is at that time, the council was questioning CCA, Common Core Civic, on this. At that time, many of us went on the record saying that we would like to stop doing business with them. And that was a time that we could have probably done something that was a little bit more binding than this non-binding resolution. And the conversation that we had hopefully was taken out of context when we spoke this morning, because what the feedback I got was that was out of touch with the community. There were some other, what I felt like was disrespectful things to me said this morning. I understand where y'all are coming from. I think that when we do this, I think it would be best that we have resolutions that look at a comprehensive look at who all are we investing in, because I guarantee you, once we start pulling back some of those, some of the layers to the onions, there's probably some other groups that we do not agree with that we're investing in, and that our employees' money is tied up in. I've said that about many other organizations that hire lobbyists that, quite frankly, lobby against our employees that we invest in. So I'm going to be supporting this today, but I want to make it very clear that when we have the opportunity to take action on a corporation, that at that time, because of some negligence, and I feel like negligence in healthcare, our employees were actually affected by contracting scabies out of a facility. Our employees were affected, and I'm still a little upset that there was not more council involvement, and that some of the very sponsors of this organization, of this resolution, did not step up and did not come out to those hearings, and it did not get the attention that I think it deserved when our employees were actually affected. And so I'm not saying to speak against this, but I think that a more responsible approach for this would be to look at everybody we're doing, not just single out who we feel is one bad actor, because I think that actually weakens the message we're trying to send. We're trying to send that our employees' money should be invested in people that we think are morally good and good corporate citizens and things like that across the board. And so I hope that organizations that push forward these resolutions and that we support also have that mentality in mind and aren't just doing things as publicity stunts and one-offs. Because we did have the chance last year.
That's insulting, Councilmember.
Can I answer your comment?
Yes.
So I agree with you, Council Lady. I think we should do that. I did it myself. When I'm not a millionaire. I have my 401k, and the first time I met with the person managing the 401k, he asked me, and I said, I want us to invest my money in socially conscious items. I don't want to invest my money on tobacco. I don't want to invest money on something that will hurt people. So I'm just wanting to do with the city what I have done with my own personal money. I think it's our money. We are sending a message of our values of what's important to us, and I think I agree with you that we should be more comprehensive and inclusive, and maybe we should start a conversation with the employees and find out what's important to them. I will ask you to look at this as a first step. And that we engage maybe in a community meeting with the employees and find out what's important to them, how to better invest their money in a ways that meets their what is important to them. And I think most of them will agree. I suspect that this is a solid thing to do, which is not to invest in this particular business. So I will ask that I get your support, hopefully, and that you will recommend this for approval.
Do we have any other questions for the committee?
I got a question. So the resolution has to do with investing in Core Civic, is that correct? And what all does Core Civic own?
Private prison industry here in this state.
I mean, is that all
We
they
can
own?
hear from their representative.
Yeah, if you don't mind, I'd like to know just what they own, what they do in Tennessee. I don't have any idea. Act like I'm just dumb as a rock, and just tell me what they do so I know what we're doing here.
Thank you, and I appreciate you, Vice Chair, members of the committee. I'm Joe Hall. I do represent Core Civic. But I do want to address a couple of things generally before I get to that, Councilman Roden. Number one, in the resolution, there's an allegation that Core Civic lobbies for criminal statutes and sentencing guidelines. It has a long-standing policy of staying out of that arena. It has no role in it whatsoever. It simply accepts offenders who have been charged and sentenced and keeps them in their care. With due respect to my friend, Councilman Davis, Core Civic is not alleged to have treated any citizens unlawfully in their care. And then on the scabies issue, those were presumptive scabies cases. So they weren't actually confirmed in the end as scabies, but they were treated. So I would say additionally, in Tennessee, Core Civic has runs some prisons for the state of Tennessee, and it also runs a detention facility in Nashville through the Sheriff's Department. Is a state contract to take care of state felons. That's it.
So how many prisons was it exactly? Do you know the number? I'm just curious. I have no idea how big they are in this state and what their footprint is.
They have three facilities in Tennessee, a fourth in Davidson County.
Okay. And that's the only thing that the company does is just prisons, is that correct?
That's correct. And it has detention facilities. I will add that the conversation around this, Core Civic, in no facility in the border issue does Core Civic separate a child from its parent. And that is policy in the Core Civic facilities in the border issue, which dates back to 2014 as a solution to help the federal government manage detainees along the border.
Are there any other private prisons operating in Tennessee other than Core Civic?
There are other private operators in addition to Core Civic. They're in the healthcare space, transportation space, and other areas where the private sector is considered to be the best solution to help government do a high-quality job at the lowest cost to the taxpayer.
So, but this resolution only deals with one company, correct? Mm-hmm. Not all privates.
Correct. It is just the Core Civic.
And can I ask a sponsor, why are we singling out just one and not all of them?
Does it matter to you? why singles went out and not the others? I mean, that's...
Yeah, it does matter.
I think what you're saying is we could be invested in these other ones, but this does not say, do you know if we're invested in other ones? So I think
The others, from what I heard, they're not the actual facilities that house prisoners, right? They're the ancillary kind of
But there
healthcare.
are other private corrections companies that do work all over.
I know they do work, but we're
States,
talking
and they're
about
publicly traded companies.
CDC,
And so-
CCA, those are core city, right?
what I think that your question is getting to, we don't know, unless there's somebody in this room, in the administration or finance, that knows whether we are invested in other private prisons.
I would not know
Looking right at you.
the other private
Okay.
prison companies that Mr. Hall has alluded to. I couldn't name those for you, so I wouldn't know.
Okay.
If we
The
had
answer is we don't know.
a list of those, then we could check that against.
The second question I have, is somebody here from the investment committee?
I'm the attorney assigned to the investment committee, and Mr. Edelman is the treasurer, who's also staff assigned to the investment committee.
Okay.
This is a non-binding resolution, is it not?
Correct. This is completely non-binding.
Can I call for the question?
You can call for the question. I'll just abstain because I don't even know what we're doing, so it's kind of as far as, I just like to get to the facts from the investment committee and actually know the facts before I say that we should invest in a
I'd like
state.
to make one statement. We are not currently invested in Core Civic, so there is nothing to that.
What do we do?
They are not currently, they will divested, but we, no, this is important. This is important because we don't ever want to be invested in anything related to this. So this is about not privatizing and sending a statement about it.
But isn't that what we're telling them, just not to
I
invest?
just want to be on the record not to do it.
Exchange. Okay, let me just back us up, and if we need to pull Mike Jameson in here, maybe we need to. So I'm going to read section 1 of this resolution. I'm going to skip some of the whereases. The Metro Council hereby goes on record as respectfully requesting that the Investment Committee of the Metropolitan Employee Benefit Board seek divestment of metropolitan government funds from those entities engaged in the operation of private prison. What I'm hearing you say is that we currently are not invested in private prisons?
In Core Civic.
In Core Civic.
We don't know
But
what
you
they
don't
are.
know if we don't have the other ones.
I don't
So
even know what
this
they
is basically, correct me if I'm wrong, sponsors, this is targeted to the private prisons, but Core Civic is the one specifically listed.
I
And
think you'd also have to change the name. You're saying divest. If there's nothing there, there's nothing to divest. But I think the intent is in the future not to invest at all. So some
so
kind of way
this is
to-
also asking, so section 2, clerk sends to the benefit board. Section 3 is chairman of the benefit board is going to respond to us on the feasibility of the request of section 1 to let us know. So, that's where, while I've already stated my opinion, I think very clearly on where I am on this, I think that if we pass this tonight in 90 days, if we get a report back saying that we're not invested in any of these private prisons,
Nor do we intend to.
we'll get the report back, then it might be appropriate to say, nor do we intend to. So, do I have a motion on the bill?
Yes.
You want to have a motion in a second?
He's
So.
already called for the question.
Okay, so the motion is to approve. All those in favor? All those against?
Why are they voting?
Yeah, sorry.
Yeah,
I just cut myself.
I'm abstaining, so it's.
Okay, we've got one not voting. We have how many in favor? Raise your hands. Freddie, are you raising your hand in any way?
I'm not on the committee.
Yes, you are.
I am.
I didn't think you knew that, but you've
Raise
been
your
on
hand.
here for months.
personnel, or is this personnel?
Yes, yes.
Raise your hand.
Rules, my bad.
So we've got 4 in favor. How you want to get?
Abstain.
Okay, 1 abstaining. Okay, that leads to 5.
Thank you for the
We
support.
can have the dump for Odell Binkley's dump. We got Odell Binkley.
Okay, we've got 4.
I
This
appreciate
is
your comment.
Mr. Chair, Parks Libraries?
Oh, sorry. Come back.
Yeah.
Thank you.
Ms. Bennett.
Core Civic.